Welcome to topic 4 of performance and reward management in healthcare settings. So in this particular presentation, we are going to focus on reward management strategies within the healthcare setting. So by the end of this presentation, I expect you to understand the importance of reward management in healthcare organizations, identify key components of reward management systems specific to healthcare industry, analyze different reward structures and their applicability to diverse healthcare settings, and finally, evaluate the impact of reward management strategies on employee motivation and job satisfaction in healthcare. So, in our previous meeting, we looked at performance appraisal in healthcare, whereby we define performance appraisal as a method of evaluating or assessing the performance of doctors, the nurses, the midwives in the hospital settings. And also we went ahead to look at some of the important methods of performance appraisal in healthcare setting. We talked about 360-degree appraisal methods, etc. So in this presentation, I'm basically now going to focus on the strategies the organizations are using in order to reward their employees. In our context, we are talking about the healthcare professionals. So before we go further, let us first look at the types of reward in the hospital or in the healthcare setting. Number one is we have financial rewards. So when talk of financial rewards, we're basically referring to salary, we are referring to bonuses, profit sharing, etc., which is given to the doctors, the nurses, and the midwives. So in our context, especially in South Sudan, when we hear the word reward, what comes in our mind is the financial aspect of it. So the next type of reward in healthcare is non-financial rewards. Here we are talking about the recognition, award, flexible work arrangements, etc., as part of rewarding a doctor for extremely performing well. So when talk of the flexible work, it means the doctor does not need to come to the facility from morning up to evening, Monday to Friday. It could be a kind of arrangement whereby the doctor could come maybe in the afternoon hours, or even once in a week, or skipping some of the working days. So it depends on the organizational arrangement with the particular employee. So that's about non-financial rewards. The next type of reward we're talking about is the benefits. So under benefit, of course, we're talking about the health insurance, retirement plans. When doctors and nurses are working in the hospital, one time they will retire, and before they retire, the organization has to plan for their retirement. So this helps a lot in terms of motivating the employees to work, because they know when the retirement time comes, they will have something to rely on in terms of finances, etc. So basically, these are some of the common types of reward in healthcare. They don't only apply in the healthcare, even in some of the organizations that are not implementing health intervention strategies in the country. You can even talk about the private companies, the NGOs, etc. They have such kind of reward plans in place. So having looked at the types of reward in the hospital or healthcare setting, now let us look at the best practices the management can put in place to make sure that they reward their employees or the doctors effectively. Number one is conduct regular employee surveys to assess needs and preferences. Not all people in an organization have the same needs or preferences. The doctors might have what they feel is better for them. The midwives, the nurses, the lab technician, everyone in that organization has different needs and preferences. So as a manager or as a human resource or as an admin of the hospital, you first need to know who is in need of what. That will help you a lot in terms of customization or personalization of the reward. The next practice is to ensure rewards are fair, equitable, and transparent. You don't need to segregate your employees based on their political affiliations, based on their religious affiliation, or based on the regional background. As a manager, you make sure that you reward them fairly and equally, regardless of where they come from, regardless of where they pray from, etc. Because in the work context, we have what we call diversity and inclusion. So it has elements of people from different religions, that is the diversity and inclusion. It has elements of people from different background or regions, okay? It has elements of people with different political views. But our focus is basically on the work. Our focus is basically on the treatment of the patients. Whenever the patients are brought to the facility, the Christian, the Muslim can attend to the patients. Okay, the political parties, different political parties, they leave alone their politics. They come and attend to the patients. So that's what we mean by fair and equitable, transparent reward system. The next one is recognize and reward individual and team achievements. If you have one specific doctor or nurse who has extremely performed well, such a person needs to be recognized. You can recognize individual or as a team, the team of doctors, the team of nurses who have been working on certain patients to recover. So you can recognize them as a team. And then lastly, continuously evaluate and update reward programs. Things keep on changing, technologies keeps on changing, the economy is changing. So you don't need to always stick on one system of rewarding, because what worked yesterday might not work today and might not work tomorrow. So you keep on updating your reward programs almost every year. So these are some of the best practices for reward management within the healthcare setting. So having looked at that, now let us focus on the tailoring rewards to the healthcare workforce. Number one is you need to consider the unique needs and preference of individual employees. For example, the doctors, the nurses, the technician, administrators, etc. All of them have a unique need. Okay, the need of the doctor might not be the same as the need of the technician. The need of the technician might not be the same as the need of the administrator. So tailoring the reward program to suit their needs is actually what will motivate them. Because if you give someone something the person doesn't like, or the person already has it, then you have not added any value to that person. But if you give that person something he also is lacking, then you must have added a lot of value in his or her life. So basically, that is how you can tailor your reward programs to your individual employees within the healthcare setting. The next one is offer rewards that are meaningful and relevant to individual employees. This point is similar to identifying the preference and needs. If you give a reward to someone which does not add value to that person, then it is not relevant, it's not meaningful. Okay, as a manager, as the administrators in the organization, in the hospital, make sure that you are giving rewards which is relevant to the employees, which can add value to their life, and which is meaningful to them. They will be appreciating it, and they will never forget that moment you gave them the reward. So you still continue with the tailoring the reward program. We are going to look at be flexible and adapt reward programs to changing needs. Okay, these employees, these doctors, the nurses, they're humans. Their needs keep on changing. So do not think of always giving the same program, reward program, to the employees over years. It might not be helping because the world is changing, the test is changing, so everything has to be changed. So you need to be flexible and update your reward programs based on the prevailing conditions of the country, especially the economy of the country. That means if you have a reward program which is more of maybe upgrading the skills of your employees, you can think of alternating it, maybe giving it financial. That is when the economy, you understand, is not doing well. It will help the employees to cope up with the pressure from the economy. So that is how you will be flexible in offering reward programs to your doctors, to your nurses, and the midwives. Then lastly, you need to recognize and reward the unique contribution of healthcare workers. Whenever there is a doctor who has treated a unique sickness, such doctor needs to be rewarded. Okay, some patients came in the hospital with the complicated issues, disease which is chronic, which has not been treated before. But if you have a doctor who has really managed to treat such diseases, it means that doctor deserves to be recognized. That's what we call unique contribution. It has never been in existence in that organization, but the doctor has managed successfully to overcome the disease. So he or she deserves to be recognized. So basically, these are some of the techniques you can use to tailor rewards based on the need of your healthcare staff. Of course, our focus is on the healthcare, but you cannot ignore other support staff. Okay, the administrators, the drivers, the ascaris, the cooks, etc. They all contribute to the well-being of the patients whenever they are brought to the facility. So moving on, now let us focus on the components of reward management. Number one component of reward management is the financial rewards. Okay, when talk of financial reward, we are basically focusing on the salary, bonuses, and profit sharing, overtime payment given to the employees. So it means that whenever the organization, we are talking about the hospital, if it is the private, has made some profit, you can decide to share it with some of the employees in an organization as a method of rewarding them. And also, you can maybe give them bonuses. It helps a lot in terms of motivating them, and also to make sure that their productivity level goes high. And also you can think of overtime. You know, working in the hospital setting is very complicated because patients keep on coming regardless of the time. It could be at night. Someone is spending a sleepless night in the hospital attending to the patients. Such person needs to be paid. So as hospital administrator, you need to take care of that very seriously. The next one is the now benefits. So you need to include a health insurance program in your reward system, retirement plans or savings, because at one point the doctors you are having might retire. Okay, the nurses, the midwives, they are going to retire. Before they retire, you need to have a plan for their retirement as an organization. This helps them a lot. In fact, nowadays people are more focused on the benefits, not about the monthly salary, because they know that at one point they're going to retire, at one point they're going to leave the organization. What they're going to survive on is the benefits. So as hospital administrators or the managers, make sure that you have a retirement plans in place for your doctors, for your nurses, midwives, and other support staffs. Then lastly, under components of reward management, we can talk about recognition. So employee recognition is very important. It could be a monthly award, or after every year you need to recognize the doctors who have been working tirelessly to make sure that the patients have recovered, the death rate is reducing, etc. So by recognizing them, you are actually motivating them to do more. Recognition does not mean you give them cash. It could be just a certificate of recognition, or it could be also maybe giving them some scholarship to upgrade. These are some of the techniques you can use to recognize your employees in an organization, or you can even promote them. So this helps them a lot to be motivated, and also it can help other employees who are not performing well to do better, because they know at one point they will also be recognized in the organization. So these are some of the components of performance and reward management within the healthcare setting and other organizations. So having looked at the components, now let us focus on we're still continuing the components of reward management. The next one is development opportunities. You need to have training programs in place, mentorship, and also tuition reimbursement. That means if the employees have been the ones sponsored themselves, you can always refund them, etc. That is part of development opportunities. It could be also promotion. It helps a lot in terms of motivating employees and also attracting potential doctors, the nurses, the midwives to come and work in the organization. The next component is work-life balance. You have a flexible work arrangements, childcare assistance, wellness program, paid time off policies, etc. These all help in motivating employees. When you do that, you keep them motivated, they will be loyal to the organization. So when you talk of childcare assistance, maybe you can have a policy whereby the first two children of your doctor or the midwife can be maybe studying somewhere. The organization can take care of the tuition, or if not all, maybe you can have a 50% kind of arrangement to allow their children to study from the school of their choice. So that's what we call work-life balance, and then which helps employees a lot, especially the doctors, to concentrate on their work. And then the pressure, the financial implications of always paying the tuition is taken off from them. So these are some of the components of reward management as far as healthcare setting is concerned. So having looked at the component, now let us focus on the criteria for effective reward management. Number one is fairness and equity. Okay, so rewards will be distributed justly and consistently based on performance, contribution, and organizational values. No employee who is underperforming should be rewarded, and then the one who is performing well should not be rewarded. That is what we call an fair kind of reward system. Doctors, the nurses, the midwives should be rewarded based on their performance. That way you are promoting fairness and equity at workplace. The next criteria is transparency and communication. So you need to openly communicate to the employees about the reward management programs in place, so that they know that by the end of the year or by the end of the time T, they're going to be rewarded based on their performance. So if you communicate to them clearly, one thing is that you are preparing them to make sure that they do work to their best, because they expect something to be given to them after their performance. So communication is very important in terms of explaining expectations to the doctors, etc. The next criteria is alignment with organizational goals. In the hospital setting, the goal of organization is to make sure that patients are recovering, increasing the rate of recovery in the hospital, reducing the death rate, etc. That is the goal of the hospital. So as an organization, or as the manager in the organization, make sure that you align the goal together with your reward system. So the reward system should basically focus on that, the rate at which the patients are recovering. If it is extremely high, it means that the doctors, the nurses, and the midwives, and people who are involved in the treatment process are doing their best. So therefore, they deserve to be rewarded. Lastly, under criteria for effective reward management, we have flexibility and adaptability. So I've been explaining for you that the reward should be flexible. Okay, do not stick on one system of reward. Maybe it has come outdated. The world is changing. It might not add any value to the doctors, to the nurses. So you need to make sure that you are flexible, and it will be adaptable based on the prevailing conditions of the country or within the organization itself. So basically, these are some of the criteria for effective reward management in the hospital setting. So having looked at that, now let us focus on the tailoring rewards to employee segments. Number one is different employee groups may have varying needs and preference regarding rewards, and that's very true. Do not assume that the doctors, the nurses, the midwives you are having, the lab technician are having the same needs. They don't. Their needs vary. So you need to have a program which targets such kind of groups. The next one is you need to consider customizing reward packages based on the factors like, one, the job roles and responsibilities. Okay. People who are having higher authority or higher responsibility deserve to be rewarded highly compared to their counterpart who are not having much responsibility and authority in the organization. So do not make a mistake of rewarding people with lower authority or roles to be rewarded highly compared to their seniors. That means you are not fair and you are transparent in your reward program. The next one is generational differences. So you need to adapt rewards to resonate with the preference and motivation of diverse generations. Okay, we talk of generational differences in the work setting. You have all the doctors of 1970s or 60s, they're there. And then you also have the young doctors, okay, of 1990s, the 2000 etc. They are there. So these people have different preferences and choices. Okay, so when you are designing your reward system, make sure that the older doctors needs are taken care of differently. Then the current generation of those come, you know what they want. So that will add value to them. For example, if you buy a smartphone, okay, the latest maybe iPhone Pro 15 or 16 or even 20, then you give it to the old Mose as a reward. That person will not appreciate it because he doesn't want it. Okay, the Mosaic doesn't know how even to use these phones, so it will not be adding any value to that person. But if you give it to a young doctor of 19 or 20 years, then you must have added a lot of value. You must have made that person the happiest doctor in the hospital. So you need to be very careful about the generational differences. The old people versus the new generation, they have different needs. The last one now is the individual preferences. We've been talking about generation or giving examples of the old doctors versus the new doctors. But now within the individual preferences, even the new doctors, I mean the young generation, okay? The young generation, they have their individual preferences. Not that everyone has the same needs. So make sure that you offer the reward based on what they want, what the doctors want, what the midwife, the nurses want. That will make them appreciated. That will make them to feel that a value has been added in their life or to their life. So that is how you tailor rewards to your employee segment. Having looked at that, now let us look at the rewarding special groups within the organization. In organizational setting, we have groups of people. Number one is the executives. So when talk of the executives, we are talking about the top management. It could be the executive directors, the CEOs, the managing director, etc. They are the people who formulate policies for the organization, the strategic direction for the organization, etc. So rewarding them is not the same as rewarding the juniors or the senior, the lower employees of the organization. So here we are going to have a competitive salary to make sure that it aligns with the industry standards. So you need to benchmark from other organizations. How much are they paying the executive directors? How much are they paying the country director, operational managers, etc. Then you align, you design your compensation package based on that. Because these are the people who lead in the organization from top. If you don't give them competitive reward, then chances are high that they might not be continuing leading the organization, because the weight of the organization actually lies on their shoulder. The next one is performance-based bonuses. So you need to tell achievement of predefined strategy goals. What have they achieved in the last 3 or 4 years? Then you can design a reward for that. Recognizing the top management helps a lot in terms of their commitment. So when they are committed, of course, the organization will excel. We are talking about the hospitals. If you have the directors, if you're working in a private hospital, which is having maybe the CEO, the managing director, etc. So you need to also recognize them. The fact that they are the owner doesn't mean they don't deserve to be recognized. So you need to also recognize them. And then we have recognition programs. So you can have it a public, or it could be within the organization. Within the organization, meaning that the employees recognize the top management for the work done. Or by public, we mean that you can publish it maybe over, if you can go to the radio talk show, maybe even a newspaper, the television, etc. Whatever media platform you can use to make it public, so that they will be recognized for achieving whatever they have done for their organization. So this is about the executives group within the hospital setting or healthcare setting. The next group is the sales professionals. So the sales professionals are under marketing. It is a unit within the marketing department in an organization. So in a hospital setting, if it's a private, of course, it has to be having a marketing department which is in charge of marketing the healthcare services, the products, etc. So under marketing sales, you need to have commission-based compensation. So with the commission, you are rewarding the marketing team based on how much services or products they have sold. That's how you give them the commission. The more products they sell, the more commission they earn. That is how you compensate the sales force. Then you have the bonuses for exceeding targets. Okay, for example, if you are supposed to admit, your target is to admit, let me say, 20 patients every day, but now you are admitting more than 20, maybe 30 or 40. The number is increasing. So you need to give them a bonus for such kind of performance because it has exceeded the target. Then sales incentive, it can be trips or prizes or recognition program for exceeding goals, just like what I've explained. If the numbers of patients coming to the hospital is increasing, it means that the marketing department, the sales team are actually doing better jobs, so they need to be also recognized and then giving them prizes or trips, etc. You can organize a trip to maybe one of the busiest city in the continent, so that they will feel that their efforts are being appreciated in the organization. Then you can talk about skill development opportunities. You need to give them more training on marketing so that their competency is enhanced. This will also boost in motivating them, etc. Then supportive work environment. So you need to provide the resource and collaboration opportunities and clear sales targets. So collaboration is very important in terms of teamwork. You need to make sure that there is a teamwork in an organization which collaborate so that by the end of the day the sales volume is increased. So the collaboration can be between the marketing department, because within the marketing I've told you there are very many departments, the sales department, the customer care, etc. And they also outside the marketing department you have other departments like the human resource, other departments like logistics and finance. All these work together to make sure that there is a teamwork in the organization. That's what we call collaboration. So now let us look at the developing effective reward systems. Number one is you need to analyze existing rewards. So you need to understand the current programs, employee perception, and the effectiveness. What is the current reward system you have in place? What is the perception of employees regarding the current reward system you have in the organization, and how effective it is helps you a lot to make sure that you develop an effective reward system. Number two is that you need to identify employee needs and preferences. We have been repeating this now. Everyone in the organization has different needs and preferences. So giving someone what the person is not interested in does not add any value to that person. Okay. For example, if the person has been using smartphone, let me say iPhone Pro 16, then for you came with their Techno to reward that person with Techno. Do you think you've added any value to that person's life? You have not. Okay, so it's very important for you to identify such needs and preferences as a manager. The next one is a design reward component. So you need to select whether you're going to use financial or non-financial reward. So we have already looked at some of these examples. Non-financial, we talk about recognition, etc. Then financial, we talk about salary, bonus, commission, etc. The last one is implement and communicate. So you need to clearly communicate to employees the availability of the reward program and the eligibility criteria. This helps a lot to avoid the issues of biasness, to avoid the issues of mistrust, etc. So basically that is how you develop effective reward management systems. So the next thing now is evaluating reward system. How do we evaluate the reward system? One is the data collection surveys. Okay, you need to perform survey or review existing interview and focus group to gather information. That's number one. Information is very powerful tool you can use to change the system within the organization. Otherwise, if you don't have the relevant information or the accurate information in place, then you will not have effective reward system in the organization. Okay. Then measuring key metrics, employee engagement, retention rates, performance indicators, cost effectiveness, etc. Are some of the metrics we're talking about. If the retention rate is very high, it means the employees are really motivated by what you are offering to them. Then identify areas for improvement. So you need to analyze that, understand what's working, what is not working. Okay. After you implement the reward management programs in place, but there's no improvement, so you need to identify the areas. Why is it like that? Okay. The next one is making informed decisions. Based on the data you've collected, now you can decide either to remain with the current reward management programs or to change them. So basically, that is how we evaluate reward management systems. So what are we going to look at here? The implication of reward and performance management. What is the implication? Number one is boosting motivation and engagement. So when employees are rewarded, of course, their motivation level goes high. And what happens if it goes high is that performance and productivity is also increasing. That means the organization by the end of the day is doing well. So when talk of the performance, we are basically talking about interaction with the patient, treating the patient, because that's where our focus is. Okay. So under motivation, you need to clearly link the rewards to performance, basically. Okay. The high performers should be rewarded. The lower performance should not be rewarded or should even be punished. That's what we call linking rewards to performance. Then opportunity for advancement and recognition. When someone has performed, the next thing is to recognize that person for his performance. It could be because of performing well or not. So you need to make sure that you have such kind of opportunity in place. Then the next one is a fair and transparent system. Okay, so you need to reward people who have really done work. Don't reward people who have not worked just because of your affiliation or association with them. It will not work. So as a manager, you need to make sure that you reward people based on their performances. Reward people based on what they have, the output. That is what you call a fair and transparent system. No one will judge you. No one will question you. But if you are not doing that, of course, you'll have a lot of questions and answers. The next thing is now enhancing performance and productivity. When we talk of productivity, we are basically defining it in terms of output. The quantity of the output is what we mean productivity. Okay, how many patients have the doctor seen today? How many patients have the doctor discharged today? That's what we call productivity. Okay, performance goals become achievable targets. Okay, that's under productivity. So rewards offer motivation to reach established goals, driving individual and team productivity. Okay. It means that if you don't have reward management program in place, the productivity level of the individual goes down. And what happens is that even the entire organization will not be productive, because the performance and the productivity of organization actually depends on the performance of its employees. Then feedback and coaching aligned with the rewards. Okay? So you need to reinforce desired behaviors and provide guidance for improvement leading to enhanced performance. It means that you need to clearly monitor the performance of the employees after the reward management programs have been implemented in an organization. So how are they behaving after giving them the reward? And if they are not doing well, what advice do you have as a manager to them to make sure that their performance is increasing or improving? Okay. Then lastly is continuous development opportunities, just like what we have explained before. There should be opportunity for development. No employee is able to work in an organization without being developed. They will not be motivated, and they will even resign because they expect to be developed, whether in career or whether financially, etc. So that is how reward management system has implication on enhancing performance and the productivity of doctors, nurses, and midwives in an organization. So lastly, let us look at now attracting and retaining top talent as one of the elements of having reward management system in place. Number one is a competitive and attractive reward package. Okay? If you have a reward package which is competitive and attractive, of course, you're going to retain the top talent. No one will think of resigning. No one will think of leaving the organization because they know what they are getting. And even you stand a better chance of attracting potential talent. Okay? Number two is recognition of individual value and the contribution. It's very important. Okay? If you recognize someone's performance, the person feels appreciated. The person feels that he or she belongs to the community. He or she belongs to the organization. Okay. Then lastly is career growth opportunities. So you need to have commitment for making sure that the employee's career is growing. For example, you can have a promotion program in place. You can have a training program in place. All these can result into employee loyalty in the long run. So that is how incentive plans, or what you call reward management plans, help a lot in terms of attracting and retaining top talent in the organization. So with that, we have come to the end of this presentation. I expect you to do more research in order to have a better view of how compensation or reward management strategy helps a lot in terms of improving the performance of the entire organization. So thank you so much for watching. We link up in the next session.